President Trump announcing Tuesday that pharmaceutical manufacturer Pfizer has agreed to lower its drug prices.
This is in response to an executive order from Trump earlier this year that required drug companies to set U.S. prices to the lowest price they sell in other developed countries, what Trump calls most favored nation pricing. Here is Trump announcing the deal yesterday.
Pfizer is committing to offer all of their prescription medications to Medicaid, and it will be at the most favored nation's prices. It's going to have a huge impact on bringing Medicaid costs down. Furthermore, Pfizer will invest $70 billion to reshore domestic manufacturing facilities. In other words, they're going to bring a lot of their facilities to make their drugs and make what they make, their product. They're going to make it in the United States.
Trump sent requests to 16 other drug manufacturers in that executive order. Some of those names told The Hill that they were still in negotiations with the administration.
The president also announced that Pfizer will make some of its most popular medications available for direct purchase at heavily discounted prices. According to Trump, those will be available online at a website operated by the federal government called Trump RX. It's still unclear what drugs will be made available or how widely they will be accessible. A senior White House official tells The Hill the website would launch early next year.
Following the announcement of Trump RX, many on social media were skeptical of the new service, but billionaire and frequent Democratic supporter Mark Cuban says this is a positive. He writes on X in part, "I think it's all great for patients as long as they always use the lowest price available. I give the program and what we know as of today a grade of a B. Why not an A? Well, the stock prices of PBMs, or pharmacy benefit managers, didn't get crushed, which means so far no one expects much change for them."
But Ron Flipkowski pointing out the irony of Trump heaping praise on Pfizer, writing on Blue Sky, quote, "I just want all my anti-vax MAGA friends to see how much Trump praised Pfizer today for all their work on the COVID vaccine."
Yeah, this guy needs to get a grip. Like, Trump doesn't have any, problem with the vaccine or Pfizer or any. He's not.
Yeah, Operation Warp Speed. He's just connecting the dots for everybody. Well, the person that you put in place, RFK, is causing chaos about, the effectiveness of the vaccine. So at the same time, you don't want to argue about that.
Let's talk about the drug price.
Fine. I don't mean
to cut you. You can talk about whatever you want, but
this is a good thing.
Yes.
I give props where it's due. Congratulations to President Trump. That's a wonderful thing. Drug prices going down is really important. I think this includes the COVID-19 vaccine, which is why Ron Flipkowski's statement was relevant, but also it includes blood clot medication, which I know, people are on across the world.
Which you need after you take the COVID vaccine. Just kidding.
And, Pfizer is going to, specifically what I liked, is going to bring down the pricing to Medicaid patients, which is really important because those are some of the most vulnerable people in our population that need affordable prices, which Trump said he would dramatically lower specifically for Medicaid patients as well. But it's ironic that the big, beautiful bill is creating chaos for those same people on Medicaid and possibly cutting some people off from accessing Medicaid. But then they're calling for discounted. But then they're calling for discounted prices for those same people who are thinking they may be getting cut off of Medicaid. So it's one of those examples of, you do something like Department of Government Efficiency, and then you have the big, beautiful bill that's like the oxymoron to all the work you've done with the Doge. And this is one of those things where, yes, you lower drug prices, but you also cut a ton of people off of Medicaid, and you're also arguing the government is shut down right now because you won't extend Affordable Care Act subsidies. Mm-hmm. So at the same time that you're lowering prices, everyone's going to be suffering because you won't have a real conversation with Democrats about, who are, by the way, winning on health care at every single poll. You won't have a conversation with them about how to solve this long term. So nice prices, but who can access it?
Yeah. Look, I think this is good news, too. I'm with you. I'm a little bit more hesitant just because I'm confused about some aspects of it that don't quite make sense to me. If buying the drug directly from the company without an insurance kind of system is going to be cheaper, then why do we have an insurance system at all? The premise of an insurance system is that any one thing, if you think about car insurance, like your car gets totaled, it bankrupts you to fix it. So instead you pay on the, a monthly or, every other month or whatever fee, so that if something catastrophic happens to your car, it's paid for and you're just paying a fee because not everyone is going to have something catastrophic happen to their car. So it's mitigating that risk of you being wrecked on a single payment. If that's how it's working for drug pricing, I don't understand why we even have an insurance system if they can make it cheap enough, whereas you could just, buy it, I guess, with a prescription. It doesn't make sense. So that doesn't make sense to me, A. B, I've always said, and while I'm happy to have the government because the government is buying the drug, so they should negotiate for better prices with the drug companies. That's fine. That's not like violating my market principles. But if the problem is the drug costs less money, it's sold in other countries. This problem can be easily fixed by ending the FDA regulation that we cannot import drugs from other countries. We could just have, you can have a global, in today's modern advanced world, we can have a modern economy that is a global economy. Amazon has mastered the art of shipping goods across vast distances. It would be trivially easy to just import drugs from wherever they're cheapest in the world. And then Pfizer would have to respond by equalizing the price across the globe. That could, again, that's a government regulation stands in that way because the government won't let you import drugs from other countries.
Well, that was one of the things that stuck out to me as well about why they're same drugs are so much cheaper in different countries, and probably because the manufacturing is a shorter shipping distance.
Yeah, I mean, like houses are cheaper in where I'm from or my family lives in rural Michigan.
With drugs, it's
like
kind of simple. Let's take like a pill form of drug. Okay,
right.
Each pill costs 1 penny to make. Then what's the sale price? What income do you guys want to make off of the?
Right.
I think it should just be 1-to-1, right? Especially with a company like Pfizer that's shipping all over the globe. How much does this thing cost to make? How much does it cost to ship? What's the cost for everyone?
Right.
And I think that if we are the people blocking that, then I would agree with you.
Right.
That shouldn't be the case.
They're welcome to try to upcharge it to wealthier people, wealthier countries. We should just counteract that by buying the cheaper version, and then you pay shipping and handling or whatever.
Wait, you want to buy the knockoff version, like whoever makes a similar type of drug?
No, the actual drug gets sold for a cheaper price, and you can have somebody buy it, have the pharmacy that buys it in wherever, in Uganda or Switzerland or Mongolia or wherever it is, the pharmacy that buys it, just buy it from that pharmacy.
Well, we're going to have to see how this actually rolls out. So I read also that these companies like Pfizer and the other ones that he's putting pressure on have up to 3 years to get this situated. So every time we hear these big, bold statements, it's kind of like this is about to happen. So tomorrow your drug prices are not going to go down.
Yeah, and my skepticism that a government-run website to buy cheaper drugs is going to end up being cheaper and more efficient. I have a high degree of skepticism about that. You probably remember the Obamacare website and what a train wreck that was. So
our government is not in the business of technology unless they bring Elon Musk back. So I'll agree that was a disaster. But Obamacare itself was a great help, especially to people like me who were up to 26 on my parents' health insurance. So it really was a beautiful thing.
Well, it was a help to some people. To other people, it was a living, waking nightmare. I know people who lost their health care coverage because of Obamacare, despite his promise that if you liked your plan, you could keep your plan, which was not true. Thousands of people, maybe millions, got kicked off plans they were perfectly happy with because they didn't meet the standards of Obamacare.
Before we go, I have to address that you're uncomfortable about the website probably not working like the Obamacare website. I'm uncomfortable with the fact that I have to type in Trump RX to get my medicine now. The
libs are gonna not take their medicine.
No, that's just a disaster. It's like when it's just the ego of it all. Like when he signed the COVID-19 checks and put his name on it. Like no other president really does that. And so the fact that he always wants to brand something like this is some massive marketing campaign, that's the thing that doesn't sit well with me. But fine. So we have to go to Trump RX for the rest of our lives if it works, and always know that our drugs are lowered in cost, even though I'm giving his kudos because of President Trump. He doesn't just want to go down in history like the rest of them.
It's a complicated subject. I'm still working through exactly what I think about it.
Now, conservatives have long accused Wikipedia of having a left-wing bias, so Elon Musk has a solution. We'll talk about that next. Don't go anywhere.